Facebook. And we'll start this webinar in just a moment, so bear with us, everyone. Thank you so much for your patience. Okay, I think we are ready to start. So it is 6:01, and I want to welcome everyone on this webinar, and I'd like to welcome everyone on Facebook Live and wherever you're tuning in from. Welcome to the 13th year that WomenNC scholars have been at the NGO Forum at the Commission on the Status of Women. We are delighted to be here again and to share with you once again the projects that our scholars have been working on for the last 10 months. Their work reflects on the review theme of this year's CSW, and that review theme is as follows: Women's Economic Empowerment in the Changing World of Work. So you'll hear our scholars reflecting on that theme as they go through the topics that they have been addressing and researching. Today's scholars will address the building blocks needed to ensure this economic empowerment. It's our belief that before women can take their rightful place as contributors to our shared economic life, there are, if you will, preconditions that need and must be present for that to happen. And you'll not be surprised that often those preconditions are not here. And so for reasons that our scholars will explore, including problems securing decent housing, securing childcare and healthcare, and even education, women have often have not insubstantial impediments to reaching their full potential, economic or otherwise. Another one of our scholars will speak to the stereotyping that also often holds us back. But I'm going to let the host and the moderator say more about the program in just a minute and what you're going to hear from the scholars. But before that, please give me just a few minutes to tell you just a little more about WomenNC. WomenNC was founded by Beth Dagan 13 years ago, and our organization has always been committed to training the next generation to advance gender equality in North Carolina, as our name implies, and to contribute to this goal worldwide by participating in international conversations like this one at CSW. If you would go to the next slide. Let me ask you, can you all see the slides on the presentation? I can't, so I'll just wait. I'm glad you can all see the slides. So perfect. So let me tell you about this work then. In addition to our work with the scholars, and you'll hear more about that in a moment, WomenNC also works with other young people. We work with the University of North Carolina at Chapel Hill's Department of Public Policy, where we jointly provide training for undergraduate public policy students to research the status of women in cities and counties across the state. From macro perspectives like the status of women in Chatham County, to more detailed analyses like how COVID-19 has affected childcare access and women's well-being and their labor force participation rates in one of our many counties in North Carolina. So we work with UNC Public Policy to also train scholars. But more than just working with students, we also sponsor a series of quarterly community education events called Critical Conversations, where WomenNC acts as a convener of subject matter experts to educate and empower our constituency on issues affecting their lives. Recent lunch and learns have included reproductive health care access in North Carolina on the eve of the 49th anniversary of Roe versus Wade, and a two-part series on intimate partner violence and human trafficking. Finally, another one of our programs, thanks to the efforts of our founder, Beth Dagan, WomenNC has been key to Durham City and Durham County adopting resolutions in support of CEDAW, which many of you know stands for the Convention on the Elimination of All Forms of Discrimination Against Women, CSW. WomenNC is the lead organization of the North Carolina Coalition for CSW, and we're now currently working with women in another one of our counties, in addition to Durham, in the west of our state, in Buncombe County, to bring CSW to another community in North Carolina. So that's an overview of WomenNC and the programs that we work on and work with. And I think I've said just about enough. And I'm going to pass it over and tell you just a little bit before I do about two people who will be taking over after I turn my camera off. The first is my colleague, Ms. Jackie Durango, who is a research public health analyst at RTI, the global think tank, and a longstanding WomenNC collaborative partner. Jackie is part of the team in the Substance Use, Gender, and Applied Research program. She is trained as a public health researcher, and her interests are addressing factors that influence disease prevention and health promotion among women in developing countries. Jackie has been a WomenNC Femtor for several years, working with our scholars and helping them to produce actionable research to improve the lives of women and girls. Next slide. In addition to Jackie, we'll also have with us today Manisha Das, and she'll serve as moderator. She's a senior project manager at RTI, and Manisha is in her second year of femtoring our scholars. Notice the word I used, femtoring, not mentoring. Words matter. Manisha provides research, technical and project management support to multiple domestic projects at RTI, focusing on genetics, psychology, health communication, special education, and child assessments. You can see I could say a lot more, but I won't. I'm going to turn the program over to Jackie and let her take over and let you enjoy the work of our scholars and understand the good work that they are doing for women in North Carolina and across the globe. Jackie?
Thank you, Dr. Ryman. The cornerstone of the WomenNC work is a scholarship program whose 2021 and 2022 participants you will hear from in a minute. The program combines social science research methods that are gender-focused with training on advocacy for dissemination and public policy recommendations to improve the lives of women and girls. Scholars are paired with applied researchers from RTI's Global Gender Center who work with scholars over a 10-month period to craft a project that identifies and researches a specific instance of gender inequality in a particular North Carolina community, suggests policy solutions to improve current conditions, and presents and disseminates their findings in a variety of far to local, for example, city councils and county commissions, state, such as WomenNC's local to global forum at RTI, national and international audiences, for example, United Nations Commission on the Status of Women. And finally, I'll tell you a bit about my experience being a WomenNC scholar and femtor. This is my second year of femtoring. I previously worked with Isa Vanderdrift, a brilliant young woman. And this year, I had the honor to work with a very dynamic young woman who will be going places, Miss Margaret Gaw. This experience has allowed me to share and give back what I've learned from my own femtors, and it is such a rewarding experience. It also challenges me to be a better person because I learned so much from these young women. It has been a pleasure to be part of this program. Now I'd like to turn the program over to today's moderator, my colleague, Manisha Das, who will introduce our scholars, interrogate them about their work, and field questions and comments from you, the audience. Over to you, Manisha.
Thank you so much, Jackie. I am so glad to be here today. And like you, I love being a WomenNC Femtor. And yes, Maria, words do matter. I'm always so impressed with the WomenNC Powerhouse Scholars. I distinctly remember sitting in the audience 3 years ago, whispering to Brittany Howard, who's on our call today as well, I need to be a part of this team. It's such a moment of pride for me, and also one that allows me to reflect on my favorite hood, sisterhood. It is so critical that we continue to build each other up, and this program allows us to do that and more. The advocacy, the research, and more of what you'll see today is just the beginning of the impactful work WomenNC and RTI's Global Gender Center does. It is an honor to be a part of this. Before the scholars share more about their projects, I would like to tell you a little bit more about who they are. First up, we have Margaret Gaw, a senior from Duke University. Next, we have Gabriela Goodman, a junior studying at UNC Chapel Hill. Following that, we have Camille Lacueille, who is our only foreign scholar this year and who actually I had the pleasure of working with as her femtor. She's a senior from NC State. Next, we have Sara Luber, who couldn't be here today due to health reasons, but her femtor, Brittany Howard, will be presenting a brief overview of her research. And finally, Kerry Rork, a senior from Duke University. Scholars, please feel free to tell us a bit more about yourself when you introduce your topic. Finally, another word about the theme of today's event, women's economic empowerment. In today's presentations, WomenNC scholars examine the myriad of social inputs needed to concretize women's empowerment, including sexual and reproductive health education, robust childcare systems and services, quality and affordable housing, and broad-based commitments to environmental sustainability. This is how the event will run. We'll give each scholar a few minutes to present their research with the help of slides. Audience, you're welcome to note your questions in the Q&A section on Zoom if you're on our webinar, or additionally via Facebook through the Facebook Live platform. After the scholars have finished presenting, I will pose your questions for you. So first up, we have Margaret Gaw.
Thank you so much. Hello, everyone. My name is Margaret Gall, and I'm a senior at Duke University, originally from Nashville, Tennessee. A bit about myself, I study literature on the pre-med path. I'm very passionate about maternal and reproductive health care and hope to work in that field after graduation. And my project for WomenNC Scholars actually centers around reproductive health care during COVID-19 in Durham County. The purpose of this project is multifolded. So first, I sought to identify barriers and enablers of women's access to high quality, affordable reproductive healthcare in this county, and also investigate how the pandemic has impacted reproductive healthcare specifically. And I was very grateful to be able to partner with the Durham County Health Department to work with them to see how the pandemic has affected their women's clinic and access to reproductive health care. And then I wanted to create something tangible out of this research. So that led to this evidence-based comprehensive infographic, and it has pertinent women's health information about how to access care during this pandemic. So motivation for this project. I mentioned a little bit earlier that I'm very passionate about maternal and reproductive health care and have witnessed firsthand through being a doula at UNC Women's Hospital, as well as an EMT in Western North Carolina, how different factors have affected women's access to care. And ultimately, the goal is to see gender equity in medicine. And I really seek to empower women to reach their fullest potential through health. So next slide, please. Thank you. So what exactly is the issue? As we all know and have experienced, there has been a lot of loss during this pandemic of lives, jobs, housing, access to care. And this has definitely affected women's access to high quality reproductive health care. So in April 2020, the CDC found that their breast and cervical cancer early detection program screenings had gone down by approximately 85% each. And I sought to see how exactly in this county these factors have played out. And at the Durham County Health Department saw approximately 2,000 visit decrease for women in their clinic across 2019 to 2020 during the pandemic. And this was found through exploring existing literature, as well as looking at secondary data from the Durham County Health Department to see exactly what was going on. And this shows up in maternal care and reproductive care, An example is women who were previously accessing the pregnancy circles at the Durham County Health Department, where they would come in person, have a community to kind of walk through prenatal care with. That was then sent online. So if someone doesn't have access to internet, to a computer, or the time and availability to do that during the pandemic, those services are lost. So that's an example of some of the negative factors that COVID has brought on reproductive healthcare in this county. So next slide, please. Thank you. So what to do about this? After partnering and talking with individuals at the Durham County Health Department, we have collaborated to make an infographic with evidence-based comprehensive information for women in this county to access, including how to make an appointment, what are the options, how to access transportation if that is an issue, what are the different options for family planning and maternal care that the Durham County Health Department offers, STI testing, taking care of health between visits when individuals are home or just need, to care between visits. And then lastly, COVID-19 and accessing vaccination and information for people who are lactating or looking to become pregnant to get the vaccine and spreading that information. Thank you so much. Ultimately, I really hope that this research goes on to continue to empower women in this county to continue to access high quality, affordable health at the Durham County Health Department. So thank you.
Thank you so much, Margaret. That was a phenomenal presentation. Up next, we have Gabriella Goodman, who's a junior with us from UNC Chapel Hill.
Thank you so much for the introduction, Manisha. So to introduce myself a bit more, I'm studying economics and public policy at UNC Chapel Hill. And after graduation, I'm interested in doing something at the intersection between research and advocacy. So this whole program was something that I was really excited about. And I ended up deciding to do my project on childcare access during COVID-19 in Durham, North Carolina. And specifically, I wanted to look at 3 key issues. Number 1, overall childcare barriers. Number 2, effects of childcare on employment. And number 3, effects of childcare on well-being and mental health. So to investigate these issues, I decided that I wanted to use a survey. So my first step was to figure out the survey logistics, and I created a 10-minute Qualtrics survey to distribute to parents or guardians with kids ages 5 or younger. And I secured funding from the Keenan Institute of Private Enterprise at UNC Chapel Hill to provide potential participants with a $10 survey completion incentive. Once I got the survey logistics sorted out, would you mind going back to the previous slide? Thank you so much. Yeah, so once I got the survey logistics figured out, my next step was to conduct participant recruitment through outreach to childcare providers and community organizations. And then I ended up receiving 75 participants that are either primary caregivers or equally share caregiving responsibilities with their partner. And these respondents were primarily women. And so my final step was to analyze the results from these responses. Next slide, please. So issue number 1, barriers to childcare. Prior research shows that common childcare barriers include high costs, lack of slots available at daycares, and then provider operating hours not lining up with parent needs. Based on my survey results, high costs are the most common source of childcare barriers, and 40% of my respondents reported that childcare barriers related to high costs are preventing them from accessing their desired level of childcare. So other common obstacles reported include risk of COVID-19 exposure and lack of slots available at daycares. And to illustrate the effects of this, I'll use one of my survey respondents. We'll call her Emma. And at the start of the pandemic, the daycare that Emma took her kids to shut down. And so as a result, Emma had to quit her job to take care of her kids. Now she wants to go back to her job, start working again, but high childcare costs combined with her family's financial situation are preventing her from going back to work and getting a job. Next slide, please. Thank you. So issue number 2, effects of childcare access on employment. For some additional background, a July 2020 study estimated that 1 in 4 women that had stopped working since the start of the pandemic had stopped working because of issues related to childcare. Additionally, a pre-pandemic study reported that the US loses an estimated $57 billion annually in revenue, productivity, and earnings because of insufficient childcare. Based on my survey, with increased and improved childcare access, about 30% of my survey participants would either look for a higher paying job, seek promotion or more responsibility at work, or pursue additional education or training. To illustrate the effects of this, I'll use another one of my survey respondents. We'll call her Fatma. Fatma has always dreamed of pursuing a PhD, but unfortunately, because of high childcare costs and having to stay home to take care of her kids, she's been unable to pursue this dream. Next slide, please. Issue number 3, effects of childcare access on mental health. 82% of my participants reported that childcare concerns negatively impact their mental health. Based on my research, people experiencing childcare obstacles experience depression symptoms at 30 percentage point higher rate than their counterparts, and anxiety at about a 10% higher rate than their counterparts. To illustrate the effects of this, I'll use a third respondent. We'll call her Ananya. At the start of the pandemic, Ananya was working remotely, and now she's working in person. And she discussed the stress associated with working remotely while having her kids running around and distracting her, and how that impacted her work performance. And now she discussed how even when she's working in person, she has to deal with the stress of potentially having her daycare call her and ask her to come pick up her kids immediately because of a COVID-19 exposure or potential sickness. Next slide, please. So based on my research, I have 3 key recommendations to help people like Emma, Fatma, and Ananya. Number 1, aggregate resources. Number 2, invest in support for low-income individuals. And number 3, expand Durham pre-K. I'll go into more detail about each of these. Number 1, aggregate resources. Navigating social services and financial aid is a complicated and overwhelming process that many of my participants discuss in their responses. By creating a more digestible and easily accessible resource for people to navigate these resources, people can better access these resources. So this is actually a project that I'm currently working on by partnering with local institutions to create and distribute something that helps people access these resources. 2, invest in support for low-income individuals. Childcare access is an issue that intersects with many other issues of inequality. So by providing a broad base support systems for low-income individuals. You can better empower them to afford childcare. Finally, expand Durham pre-K. Durham, the city that my research focused on, actually does have a program that provides free childcare for kids age 4 from households that have an income that makes them 300% below the federal poverty line. Expanding the service to include kids of more ages and families of more income levels can help more families. So, as I mentioned before, implementing these 3 recommendations can help people like Emma, Fatma, and Ananya, but it can also address more macro level inequalities, bring a more diverse set of individuals into the workforce, and increase economic growth. Childcare is central to economic empowerment, particularly for women. And if we want to stop perpetuating cycles of inequality, it's essential that we invest in improving access to childcare within the US. Next slide, please. Thank you so much for listening, and there's some of my information there, and I'm happy to answer any questions during the Q&A session.
Thank you so much, Gabby. Sorry, that was a really beautiful presentation and also so timely given what has been going on with women since the pandemic started. And so I really appreciated that. Next up, we have Camille. Just a word, I was fortunate enough to be her femtor, and again, so proud of you and all the work that you've done. So Camille, take it away.
Thank you so much, Manisha. So good morning, afternoon, or night, everyone. Thank you so much for being here today. I am Camille Lacueille, and I am originally from France when I did my 2 first years of university at Neoma Business School. I am currently majoring in business administration at NC State University, and I have also a minor in women's and gender studies. My research question is, how can the Wake County public school system deliver a comprehensive sexual health curriculum for all students under current North Carolina laws? Next slide, please. First, I would like to start reading you this quote from a high school student in Wake County, which is the biggest school district in North Carolina. We, LGBTQ+ students, need to learn. We deserve to be safe as well, because everyone else is learning. Why not us? When you come from another country, you unconsciously compare everything in your new environment with what you have always known. What struck me the most when I started my research for this project was the law regarding sexual education in North Carolina. Where I come from, we speak freely about sexual relationship, and even at school. Our sexual health curriculum is very comprehensive and inclusive. It allows us, students, young adults, to be safe and engage in physical relationships serenely without engendering our health. Why does comprehensive sexual health curriculum matter? Next slide, please. A lack of comprehensive sexual health curriculum for all students has repercussions on physical health. It can lead to STDs, pregnancy, and prevent the LGBTQ+ community from getting information to ensure their health during intimate relationships. Now, I will ask you to think about a time you were physically ill. What were the implications on your mental health? Indeed, more than the physical health, a lack of comprehensive sexual health curriculum also impacts the mental health of our students. Therefore, it impacts their academics, their professional achievements. It also increased the school bullying among sexual minority subgroups. Next slide, please. So here are the methods I used for my research. I first conducted a literature review to identify the gap. I conducted informational interviews. I did one in North Carolina with a senator from Charlotte in order to understand more about the historical background of the laws. I have also talked with a Wake County School Board representative who helped me understand what was going on in Wake County High School regarding sexual education and what was different from the Wake County curriculum. The Post Center is a nonprofit organization dedicated to work with schools to provide health education to children. I was able to talk to the Family Life Program director there. I eventually learned that the Post Center is organizing field trips with certain schools in Wake County, during which the students are taught about reproductive health. After the analysis of the data I gathered, I was able to come up with some recommendations. I will still show you some of my findings. But before, let's take a look at those numbers. Next slide, please. Are those numbers compelling? Did you expect the number to be this high? 60% in 12th grade students are engaging in sexual relationship. This means that in a class of 10 students, 6 of them will have already engaged in a sexual intercourse. Next slide, please. Let's take a look at those slides. It doesn't matter their sexual orientation, students in North Carolina are having sex. Next slide, please. So here are the key findings from my research. In Wake County High School, teachers, nurses, and guest speakers are not permitted to give information about contraceptive and abortion referral service to students. In 2018, in North Carolina, young people accounted for 66% of new chlamydia diagnoses and 48% of new gonorrhea diagnoses. This means youth accounted for more than half of the diagnoses in the state for those diseases. Shift NC, which is also a nonprofit organization in North Carolina, study found negative consequences for LGBTQ+ students in Wake County due to the lack of specific information for their needs. In fact, one student mentioned in that study that he was told by the sex education teacher that their teacher was not legally allowed to respond to the LGBTQ+ related questions. Health indicators from the Post Center do not demonstrate the proper use of condoms, which contrasts totally with the education French students receive at school. Next slide, please. So here are the recommendations I came up with regarding to my data and my study. I want the creation and distribution of comprehensive sex education resources for all students, including LGBTQ+ students, in a form of brochures. I would like them to be distributed after class to all students and not just available in teacher office, admin office, or guidance counselor office to diminish any hesitation to access those resources. The Healthful Living, which is also the course where Wake County students are taught sexual education, often taken in 9th grade in North Carolina, should be instead be made mandatory in the last 2 years of high school. As we've seen with the figures before, this is the 2 years where students in North Carolina are most likely to engage in sexual relationship. I also require training and qualification for Healthful Living teachers, because right now anybody like a gym teacher can teach this class without any proper training. Next slide, please. Thank you so much for listening, and here are my contact information. Do not hesitate to reach out if you have any more questions. Thank you.
Thank you so much, Camille. Up next, we have Brittany Howard presenting Sara Luber's research. Brittany?
Thank you so much, Manisha. And I just have to say, I can't agree more. Every year, the WomenNC scholars blow me away, and they warm my heart just getting to see all the wonderful things that they're doing and going to do. As Sara's femtor, it's an honor to be here today and share her research and her slides with you. She focused on the green feminine stereotype and the eco-gender gap, and I will define those terms in just a second. But Sara is very interested in researching how gender impacts sustainable consumption in the North Carolina Triangle area. And her topic comes at a very critical time for all of us, given the UN's latest environmental report, I believe last week, citing the irreversible damage headed towards the next generation. Next slide, please. So I'd like to define these terms because I know they're a bit lengthy and maybe a bit unwieldy when you first look at them. The eco-gender gap is the difference in use and consumption of sustainable or reusable household products between women and men, and the idea that women are more environmentally conscious and participate in green behaviors more often than men is defined as the green feminine stereotype. So this matters because it takes a village. It takes the entire global community to stop and reverse the damage that we've caused on the environment. Next slide, please. So Sara worked very, very hard, as we all know how hard it can be to get through IRBs if you conduct research. So she worked very hard to obtain an IRB waiver from NC State to conduct an in-depth interview with a Durham environmental professional, as well as conducting a literature review. We worked very closely together to kind of go over the ins and outs of what a literature review is. And ultimately, we decided on going through PubMed and Google Scholar, and Sara define the terms of green feminine and feminism and sustainability or ecofeminism for her search. We ultimately, after some discussion, ended up she wanted to include 21 articles in her review. Next slide, please. So she found that the green feminine stereotype occurs around the world, with women striving to break away from the cultural gender norms, historically taking care of household chores such as doing laundry, cooking, cleaning, recycling, buying the reusable products that are kind of coming about nowadays. And here's one quote that she actually shares in her full paper, which will be available online at WomenNC. In general, cleaning products and household products are more marketed towards women anyway, because women are the people seen as doing the cleaning. So I think the green products follow that and use the same marketing as traditional products do. It's kind of messed up that traditional products are that way. And I think we kind of all see that no matter what stores we go into. She also identified possible solutions to equalizing this dynamic, which included addressing these different gender disparities within varying cultural contexts. You know, there's no one shoe fits all size, as we know with research. And even though progress is being made towards gender equality in different areas of the world, including in the environmental stance, we all know there's still so much more work to do. Next slide, please. So Sara is very interested in addressing one big elephant in the room throughout her career, and that is the branding and marketing of household products. So when you're walking down any aisle, any store, doesn't matter where you're at, Walmart, Target, CVS, wherever you shop, you could see the screaming pink and purple and dainty products targeted towards women here. And then next slide, please. The kind of darker, edgier, more masculine targeted products seen here. And then quickly to the next slide. Thank you so much. And then you still see this even with Grove, which is a really great and possibly the most popular sustainable shopping site to date, that they're still enforcing these feminine stereotypes you see across their website of women using these products more substantially than men. So next slide, please. So Sara really wanted to take this undertaking on throughout her career of kind of going after the gender neutral marketing. So getting into kind of that sector of things, she was really adamant about that. But then also some policy incentives, such as lowering taxes on sustainable products, offering tax rebates, as well as recycling incentives, including how we see across many different countries around the world of reverse vending machines where you can return a product and get some of your money back or a coupon or something like that, as well as 10-cent plastic bag fees or discounts off of your final bill. And she actually found in speaking with the Durham environmental official that pre-COVID, which really threw the world in a spin, as we all know, Durham was considering one of these initiatives. And so I know that she was very excited to hear that and is hoping to somehow get that going again. So thank you so much. And I will hand it on back.
Thank you so much, Brittany. So our last presentation before we open it up to Q&A is going to be by Kerry. Before that, just a quick note, if you do have questions, feel free to submit them in the Q&A feature on Zoom or also in our Facebook Live comment feature. We are monitoring that simultaneously. So Kerry, take it away.
Yeah, so my name is Kerry Rork, and I am a senior at Duke University studying political science and history with concentrations in normative political theory and law and governance, respectively. My research is with WomenNC on housing insecurity in Durham, North Carolina. Next slide, please. So this is a little bit of a table of contents of what I'll be talking about today. So we're going to start with a little bit about the historical housing trends in Durham, North Carolina. Then I'll go more specifically into housing during the pandemic and how COVID-19 ended up exacerbating a lot of existing housing inequity. And then finally, I'm going to address 3 housing solutions that I found for Durham, North Carolina, following my research and my data. Next slide, please. I'd like to open with a quote from one of the many residents of Durham, North Carolina that's facing housing security today. In this interview through Legal Aid of North Carolina and the Durham Eviction Diversion Program, we asked how COVID-19 had impacted her home. She stated, "I paid my bills the entire summer, and now I need help because I have no money. Now you're going to tell me there's no funding left. My bills are due now." Next slide, please. In Durham, North Carolina, and around the country, thousands of individuals face homelessness every day. Importantly, beyond immediate shelter and physical safety, housing insecurities implications extend to areas such as educational outcomes and the stability of family units. During the COVID-19 pandemic, existing housing insecurity was exacerbated, reaching unprecedented levels. Although recent data indicates that the economic hardship of the pandemic has decreased from its peak in December 2020, the pandemic continues to wreak economic havoc on communities around the United States. Despite the allocation of American Rescue Plan funds, according to the Center on Budget and Policy Priorities, as of September 10th, 2021, 11 million adult renters, or 15% of all adult renters, are behind on rent. Within this percentage, Black populations were disproportionately represented, making up 22% of these households. Statistics from the Pew Research Center further indicate that employed single mothers experience the greatest decrease in employment and therefore one of the greatest decreases in housing stability. In Durham, North Carolina specifically, 45.6% of households rent, proof of the large need within this community. Additionally, on any given night, 590 people experience homelessness in Durham. Now that's actually a lower estimate, and that's actually a pre-COVID data. We don't have a lot of data post the pandemic, and so we're expecting that data to be much higher. Proof, again, of that need. Next slide, please. In this project, I investigated the causes and effects of housing insecurity in Durham, North Carolina. I particularly focused on data related to the COVID-19 pandemic that, as mentioned, exacerbated existing housing insecurities. Using interviews from individuals struggling to maintain their housing and data from local and national sources, I first established the need for housing solutions in Durham. My research methodology was then a mix of a qualitative and quantitative literary review. With this information in mind, I investigated solutions around the country. Next slide, please. I conclude that the following 3 options would be appropriate solutions to the housing insecurity crisis that's happening in Durham: the development of affordable housing, the formalization of the status of landlord, and continued educational outreach. Under Mayor Steve Schewel in 2019, $95 million was allocated for the development of housing for low to moderate income residents. This includes the construction of 1,600 affordable housing units, aid to 3,000 low-income renters or homeowners to remain in or improve their homes, among much else. What is important to note is that given the influx of large corporations like Apple and Google, many more will face homelessness than did before. Therefore, we must allocate a percentage of this funding to the development of housing that is truly affordable for Durham residents. The second is the formalization of the status of landlord. As was made clear with the client stories that I investigated throughout my project, landlords are able to exercise unruly and arbitrary power outside the restraints of law. This makes it easy to manipulate and harm tenants. In response, the city of Philadelphia is one of the first to establish the position of landlord as one that requires a commercial activity license for all properties with more than 4 units. Falling under the definition of a business owner, the landlord would be mandated to receive a commercial activity license in order to rent units. This solution creates more checks on the position of landlord, such as housing authority inspections and continued governmental intervention on behalf of both the landlord and the tenant. Because of the difficulties of completing this documentation and the following payments, it incentivizes the maintenance and protection of the properties. Furthermore, by creating a list of business owners in Philadelphia, which can be accessed on their city website, including landlords with addresses, no landlord operates outside the view of government. Finally, I want to discuss the importance of educational initiatives throughout the city. Rather than responding as the cases arise, we need to consider proactive methods that ensure future stability and security. The legal jargon surrounding housing cases, coupled with the complexities of rental rights and statuses, make much of this information inaccessible to residents around the country. There is power in knowing to say continuance, which is the pushing off of a case for a few months in a courtroom that many do not comprehend. For Durham County, I would recommend creating a guide that relates to the changing housing circumstances. During the pandemic, there was eviction moratoriums, rental assistance programs, among much else that were difficult to follow and involved numerous qualifications. The guide would provide regularly updated information for Durham residents on housing policies. Additionally, it would provide tools if one was facing an eviction, such as resources, things to know or do, definitions of legal terms. The complexity of legal jargon and the outcomes of eviction make such solutions ever more pertinent as individuals continue to face housing insecurity. These three solutions, though not enough to eliminate all issues surrounding housing, provide a means of eliminating some of the risks. Its importance has only grown as the pandemic wreaks havoc on communities around the country. Final slide, please. Thank you. So I also have my contact information. If anyone has any questions, feel free to reach out to me.
Thank you so much, Kerry. That was a great presentation. So now what I'm going to do is actually we're going to highlight it so that all the scholars and myself and Jackie come up for Q&A. And I think what we'll do first is just like a round robin of questions for the group that have come in, and then we'll go ahead and ask individual scholars questions that have come in. Okay, so the first question for the group is, what was the most challenging part of your project? And we'll go in the order that I see you all on my screen. So Gabby, you're first.
So I think for my project, the most challenging aspect was participant recruitment and trying to get my samples of respondents to be as representative of the Durham population as possible. And so I think something that really helped with that was being able to provide an incentive for survey completion, so I could get like a more diverse set of individuals to take the time to take the survey, and just being persistent in reaching out to a wide variety of organizations and getting the survey out there.
Thanks so much. Yes, persistence is key. Often in these situations, you'll learn that no matter where you are in the research world. So great. Next on my screen, I have Camille. So can you share with us what was the most challenging part of your project?
Yes, I think for me, the most challenging part was definitely time management. I have a lot of credits for my classes. So, you know, it's a really a subject I'm passionate about. So it was good that I worked a lot on it, but it was also hard, you know, to actually make a lot of free time for this project. But I'm so glad I did it. But it was a hard part, definitely.
Great, thank you. Kerry, you're up next on my screen.
I would say the IRB process was very frustrating. I know most of us can relate to that. And obviously working with the population that I chose to work with, where a lot of these people are facing housing security, and there are at times questions of citizenship and that things of that nature. You definitely need to go through those processes. So ultimately, given the time constraints of the program, I ended up choosing to do a literature review instead of my initial plan, which would have been to conduct a lot of these interviews. Conveniently, I had actually completed a project with the Durham Eviction Diversion Program earlier that year, where I had interviewed some clients, and those that had become public domain on the Durham eviction diversion website, I used a lot of those in constructing a lot of my arguments. So it ended up working out, but definitely a frustrating component of research.
Yeah, and would you mind, just for those in our audience that may not necessarily be familiar with an IRB, can you just expand on that a little bit, or I'm happy to help you as well.
Yeah. So IRB stands for the Institutional Review Board, and essentially the goal is that you turn in information about the study that you're going to conduct. So in my case, I was going to conduct a series of interviews with both individuals who are facing housing insecurity, as well as like Durham City Council members and local nonprofits. And you turn that information in, sort of the ethics around your study. So all the information that you can provide and how you're going to make sure that those that are being interviewed are going to be protected. And it's a long process. And of course, like, it should be a long process. There's so much information that goes into it, and you'd rather protect the people that are involved. But yeah, it definitely is difficult if you have a project that operates in any kind of time constraint to complete that kind of project.
Absolutely. Yeah. I'm in the research world myself, and I can say, while, Kerry is exactly right, it protects, human subject research, but it also is something that frequently presents challenges, especially when you're against a timeline. So great. Next on my screen is Margaret. Margaret, do you mind sharing with us the most challenging part of your project?
Of course. I think going off of the theme of persistence, something I knew coming into the project was wanting to, join in on ongoing efforts to increase access to accessible reproductive healthcare in Durham County. And so, tried to reach out to various, clinics and individuals, stakeholders kind of working in this field, and just finding that partner who has the capacity, energy, enthusiasm for this work to kind of contribute to their ongoing work was a challenge, and it just took persistence and reaching out.
Great, thank you. So the next question that we have for all four of you is, what was one thing that happened, and you can maybe expand on this, from given the most challenging thing too, but one thing that happened that you least expected, or that was the most surprising during your project? And we'll start again with you, Gabby.
I think what was most surprising to me was just the extent of childcare obstacles experienced among individuals. I think going into it, I knew that it was a major problem that disproportionately impacts women and people of color, but like even higher income individuals talked about the challenges associated with it and the obstacles that it creates in terms of the employment opportunities that they're able to pursue and the effects on their overall well-being.
Thanks, Gabby. Camille, what about you? What was the most surprising thing you learned along the way?
So as I said in my projects, I work on a sexual curriculum in North Carolina, and I knew it was a quite conservative state we're getting to those laws, but I was very surprised that actually, items that was written in the laws and compare with what we have in France. I was very surprised that, is actually that that non-inclusive. So that was very surprising, and that's why I decided to work on this project. But I really didn't thought that it was going to be this, this non-inclusive.
Great, thank you. Kerry?
Yeah, I think the thing I found most surprising is I've been working with Legal Aid of North Carolina for a year and a half now. And actually, when I was working on this project, I ended up sitting in a courtroom during some eviction hearings. And we had a few cases where some of the individuals who were going up during the case didn't have legal representation. And listening to sort of how the case was handled, it's sort of things are happening to you and words are being used that you're uncertain of. I had one where a woman was told that she was going to be evicted, and she kept asking if eviction means I have to leave my home, and they wouldn't define that term for her and say yes. And in X amount of days, a sheriff's going to be knocking on your door and you better have everything moved out. And so I think one of the things I realized is just how inaccessible so much of this kind of space is, and how inaccessible a lot of the words that we use, and they mean like whether or not you're going to stay in your home. And that's really powerful, because that's something that you feel like should be so easy to change and so easy to bridge that gap if people just like defined things and made things easier. But yeah, so I think it's just, you see I felt a lot of frustration in finding solutions that seemed easy and were not implemented.
Thanks, Kerry. Brittany, do you want to answer on behalf of Sara? I feel like as her femtor, you were probably closely involved with the challenges that she faced, and also what
Yeah.
So.
Yes, no problem. So I do have to say that IRB was probably the hardest, but I think it's because perhaps IRBs are just not used to such young, strong women coming in undergrad wanting to do some actual research. So maybe a good problem to have, and I think the program is doing great, and there's always a workaround and how to get past that. I do think that us having the constant being able to text back and forth and kind of troubleshoot, and just having the connections and just being able to go to somebody and say, hey, do you know so-and-so who could maybe speak with IRB or can get me a phone call or things like that. So I think it's lessons learned, even though it was a challenge, we both together found out a lot about how to overcome those challenges. But yeah, IRB.
Great, thanks, Brittany. Margaret, how about you? What was the most surprising thing that you learned along the course of your research?
Yeah, so I think going off of some of the other responses, kind of knowing anecdotally and hearing and reading about the strain on healthcare in general that this pandemic has caused, but kind of just seeing the data and the numbers behind it added a level of surprise in terms of the extent, specifically for the Women's Clinic at Durham County Health Department.
Great, thank you. We have one more question for the group, and then we'll go to some individual questions that have come in. What would you like to tell the next group of scholars about your work this year? What should they know, and maybe what should our audience know about the program? And actually, I'm going to flip the script a little. So Margaret, we're going to start with you, if that's okay. We'll go in reverse order.
Yes, of course. I love this question, and just knowing that this program provides the support of an incredible femtor, and having that experience of getting to work with experts already in the field. And then general advice, I think just having, I think Jackie and I talked about this, but kind of this sweet spot where your passions and interests meet a need and sort of opportunities that you're able to become a part of.
Great, thank you so much. Kerry, how about you? What would you share?
Yeah, I think I would add to what Margaret said. I think the thing that made my project in some ways easier, in some ways harder, was the fact that I have already dedicated a lot of time to housing related issues. And so it felt like a natural extension of everything I had been doing, and a natural, honestly, culmination of a lot of work, because I think these are things that I've thought about for so long. So I think having that passion, it makes the project more interesting, and your passion, I think, translates when people are speaking and when you're giving your information. So I think that's one of the most powerful things you can have, is think of a project that whether you relate to it because of your identity, because of your the research you've already done, your volunteerism, whatever it may be, that's where you should be. That's what you should be going into.
Great, thank you. Camille?
Yeah, so as Kerry and Margaret said, an advice I should give to a next scholar would really choose project you're passionate about. You're going to spend a lot of time on it, and it needs to drive you, it needs to really really be something you're passionate about. And what is great about those projects is actually you're making a chance, being able to present your research and show it to the world what we're doing right now. And also after with the advocacy part, being able to actually make some change in your community. This is very something powerful.
Yes, absolutely. Thank you. And Gabby.
I completely agree with what everybody else has said. And I think just take advantage of all the resources and experiences of the people who you have access to as femtors, and ask questions and get advice on different potential avenues that you're interested in. And also dream big about the potential advocacy and research opportunities that you can pursue. And then even if you don't actually achieve that, I think the bigger you dream, the more you can accomplish.
Great, thank you. And we did have a question come in the chat, I think just before you guys started answering this question, and it said, do you have any advice for a scholar who may want to be a WomenNC scholar? And we'll certainly share the website before this webinar is over as well, but does anyone have a burning sort of desire to answer that question? We kind of just did, but if there are any like specific advice for someone who might be watching this that wants to be on this screen in a year from now, what would any of you say?
I think thinking about your capacity, like timing wise, like more from a practical perspective, because it is a commitment. And I'm of the opinion that when you're going into something like this, you need to be ready and willing to give it your all. Because there are not many times in life when you get the kinds of resources a program like this provides that are just handed to you. And so you want to make the most of that. And I know when I've met with so many local organizers and spoken about the work that I was doing and said it explicitly to them, like, is there a message that you want me to make sure gets into this paper? Because I want to make sure I'm using my opportunity as working with a national organization to make sure that what you all are doing is getting uplifted. So I think it's just knowing that in your schedule and in your life and in what you're doing, you have the time to really give this program what it deserves.
Great, Kerry, thanks so much. I want to have the opportunity now to ask some of you some specific questions that have come in for each of you regarding your research. Jackie, do you want to start with the questions that you had, or I can start?
Sure, I could start. Excellent, Gabby. Thank you. Thank you so much. So specific questions and I'll start with you, Margaret. As I mentioned, Margaret, working with you was such a pleasure. You had firsthand experience in collaborating and conducting research in a real world setting. That is at Durham Department of Health. Please share about pivoting and making lemonade out of lemons when the research process developed some challenges, being able to adjust to the real world setting as a researcher.
Thank you so much, Jackie. Yes, so, I came into this project with kind of a more broad scale vision of exploring women's health during COVID, and didn't necessarily have a partner in mind from the beginning. So in terms of pivoting, I talked to physicians, I talked to people at clinics, just to hear, again, who had like that energy and bandwidth to be able to collaborate. And also learned a lot during that process about how COVID has impacted reproductive healthcare, that actually added to kind of my question and added to some of the information that I was seeking to kind of explore. So I think in the pivoting, there's also progress and learning.
Thank you so much. Thank you so much, Margaret. So I will pivot and move to some of the questions that are on the Q&A. There's a question from Dylan for Kerry Rork. In questions of federal aid, where did you feel funding is most desperately needed? Should we prioritize preventative measures, that is building more affordable housing, or mitigated measures such as rent forgiveness and rent moratoriums?
I mean, obviously the pandemic was a very unique situation in which we were, a lot of the solutions were very much responding as problems came up. And so that's why we had moratoriums, we had rent forgiveness. We did not have the infrastructure in place to handle a housing crisis. Ideally, the ideal world would be we're operating on a preventative scale and we're it's not just constantly putting band-aids on a failing structure, but building up that structure. So I would say right now, we're sort of in a weird space. And that's why my solutions, they probably operate more on the preventative side, except I think educational initiatives. And I think the educational initiatives is the one that can be both preventative and mitigate those kinds of problems. So I would say federal funding needs to be going right now everywhere. Ideally, we need to be developing affordable housing. We're about to have a bigger housing crisis in Durham with Apple and Google coming in. We need to be developing educational initiatives, and we need to be making sure that landlords are actually being, like, there's actually checks on landlords. So it's kind of both. It's kind of a difficult question because you could take it anyway, but we need everything right now because of how difficult housing is becoming in Durham.
I agree with you, Kerry. That was very insightful answers. And the next question is for Camille. What are the main differences between French health and sexual curriculum and French health and sexual what is the difference between, the French and the US sexual health curriculum?
Yeah, thank you for this question. First, in the North Carolina curriculum, there is a sentence that say that safe sex should be made inside marriage and in a heterosexual way, which we've never been told in France. Like, we never heard that in France. This is one of the thing that struck me the most at the beginning. Also, in the Wake County and North Carolina curriculum, it is said that the distribution of contraceptive resources, it's not permitted. And same in France, this is something we never heard. And actually, contraception is even shown and give at school if you want to. So, this is one of the main big difference. And we all know how contraceptive is important, especially as a woman. And last difference in France, at least it was the case in my school, and I know it's the case in all the schools, it was actually NGOs that were coming from, not from the schools, it was actually qualified teacher from NGOs who teach us sexual education. It was not just a random teacher. This means that we didn't know the people we were speaking to, so we were not embarrassed to ask questions. And they were very qualified people that were used to teach sex to children and students. And it made it very easier and very comfortable, at least. And that is one of the main difference.
Thank you so much, Camille. That was a great answer, and especially with our project working in sexually reproductive health, it is really important to have that discussion at an early age and throughout, a woman's life. So the next question is for any of the young scholars. How do each of you plan to keep gender equality and equity central to your future work? And what are your plans for graduation, after graduation?
I can start with this question because this topic is very central to what I want to do as hopefully a future OBGYN and a physician who writes and works in policy that really centers gender equity, LGBTQ rights, women's rights. And after graduation, I hope to work a little bit before applying to medical school, hopefully in OBGYN research or policy work. So yeah, those are my plans for the future.
I can go next. So I'm graduating from NC State in May, and I applied for a school. It's called Sciences Po, but it's also called Paris School of International Affairs, and actually want to go in the program called Human Rights and Humanitarian Actions. And in this master program, there is a high diploma in gender studies, and I plan on doing that. You can take that as an option in that semester study. So it will be 2 years starting in September. So hopefully I'll be taken.
I can go next. My plans, as of like a week and a half ago, I actually committed to UCLA Law. I will be going into public service kind of law space right now, probably centering on housing in some capacity. And I mean, gender inequity is so fundamental to so many of the issues that I'm interested in, whether that's going to be on a domestic level or an international level. So regardless of what I do, that will be at the heart of a lot of what I'm interested in. So yeah, those are my post-graduation plans.
I'm not totally sure what I want to do, but I'm interested in potentially pursuing a PhD in economics and focusing on policy research. And then how I want to center gender equity within that, I think there's 2 parts to it. Number one, pursuing gender equity in kind of the traditional sense and focusing the policy research that I'm doing on how to uplift women in marginalized communities. But then I also think part of centering gender equity in that type of work can look like just reaching out to other women and supporting other women in the space. I think particularly economics. In economics, women are underrepresented. So just kind of centering women in that regard also.
Thank you so much. We are really proud of all of you, and we look forward to following you in the future. I'd like to ask Gabby one question, and then I'll move it on to Manisha to continue asking the questions. Gabby, it was quite resourceful to find funding from the Keenan Institute for Private Enterprise to cater for incentives for the survey participants. I believe this is the first time we've had this. Tell us why you thought you needed the funding and how the Keenan Institute was able to fund you.
Yeah, so I think just doing research on surveys and how to get respondents, I think the research shows that providing some sort of incentive is really important for getting both quantity of respondents, but also quality, and by quality, I mean kind of a more diverse demographics within the respondents. So that was why I really wanted to be able to secure some sort of funding to, as Dr. Wexberg has put in the chat, reimburse participants for their time. And so I was able to get funding from the Keenan Institute of Private Enterprise because they host a scholarship program called Keenan Scholars, and that's something that I'm part of. And so as part of the Keenan Scholars program, they have a fund called the Exploratory Fund, where students within the program can apply for funding to pursue opportunities related to professional development. So I was able to apply for money from that fund to use as the survey incentive.
Thank you so much, Gabriella. That was quite resourceful. Manisha, I will hand it over to you.
Yeah, Gabriella, I want to commend you as well. I don't think that's ever been done in the history of scholars working on their projects through WomenNC. So well done on discovering that resource. So I have a specific question for Camille. And the question is, can you tell us why you chose your topic? Why are you interested in education, and specifically in reproductive health education within this space?
Yeah. So education, I think it's part of, like, it's very important. It gives you power. You know, I do think that education is directly linked to power. And when you look at sexual education, it's directly linked to sexual rights. And I do think that knowing about their body, students will be empowered and, you know, have more power. And I do think this is very important. And my research also showed that there is actually a link between sexual education and the future life of students and women. And there's a lot of women that for example, get pregnant very early in age and then don't keep going with their studies or don't go to college and then, just lose economic power or even academic achievement. And I do think this is very important, and this is part of everyday life, and everybody should have the right to have like a truthful and quality education.
Very true. There is so much knowledge in power and in education. So great. Kerry, I have a specific question that came in for you. Can you tell us about your research methods? You mentioned in your presentation that you used quantitative and qualitative methods. For the non-research participants, maybe, can you tell us a little bit more about what that means and what that looked like specifically in your project?
Yeah, so I relied a lot on data from local organizations. So one being, as I've mentioned, Legal Aid of North Carolina, that was a big one, but also DataWorks NC, as well as Families Moving Forward, and a few other like local nonprofits. So they provided data related to housing that I analyzed to sort of look at what where the housing issues are. One of the best resources was the legal aid source, because there is a breakdown by zip code and by demographic of where exactly the housing issues are and with what group. So that was a super useful piece. And then on the qualitative side, I looked at a lot of interviews. I think there is so much power in how people understand these problems and how they're experiencing them, that is not often appreciated. And so there's a lot of interviews out there. And as I mentioned, there are some through the legal aid website, as well as another source that was a project through UNC that I really enjoyed as well. But a lot of that was sort of framing what are the issues. So when people were talking about, my issue is I don't know who my landlord is, or my issue is that I don't know what my rights are. Those sorts of conversations and those sorts of quotes were really fundamental to sort of shaping like, okay, well, clearly a lot of people are saying like that they need this thing, and how would we address that? So that's sort of my research method. It was a lot of reading a lot of different sources and a lot of meetings with local organizations. And each of them provided all sorts of different resources and all sorts of different ways of thinking about it. Yeah, so that's sort of the method that I use.
Great, thank you so much. Margaret, we had one that came in for you, and I know at the beginning of your presentation you mentioned that you work on the front lines as both a doula and an EMT, and so can you maybe share how that experience, both of those experiences, sort of informed your research project and your work?
Definitely. Yes, I worked as an EMT in rural North Carolina, and seeing gender disparities there really was part of kind of the fuel for this fire, so to say. And then working as a doula during COVID especially highlighted some issues that were already exacerbated because of COVID in reproductive healthcare. But just, being with women whose partners, tested positive for COVID and then couldn't be with them during that time, or just adding like a whole another layer of stress to that experience. So I think, yeah, being there in the birthing room and working with women and seeing that firsthand really just added a whole another layer and perspective to this work.
Thank you so much. I think we have time for one more question, and then I'm gonna give the mic back to Maria. But Gabby, for you, can you say more about your policy solutions? Maybe you can tell us if you're putting together a resource for Durham County and what kind of information it'll contain.
Yeah, so the three general buckets of my policy recommendations included aggregating resources, that's number one. Number two, just in general, expanding support for low-income individuals when it comes to food insecurity or housing. And then number three, expanding the universal pre-K program. And so you specifically mentioned the resource. So what I'm currently working on is compiling kind of a broad resource that includes all of the potential resources that can help individuals with issues that intersect with childcare. So yes, specifically information about how to access like financial aid resources and government subsidies for childcare, but then also issues that disproportionately affect those individuals that struggle with childcare. And so I'm partnering with institutions to then within the local community. So for instance, church groups to help distribute this resource.
That's great. Thank you so much to all of the scholars tonight for sharing such amazing work that you're doing, the advocacy that will follow this research. We are very excited, as some people have said in the chat, to kind of follow along your journey and see where things go next. And I'm going to give the mic back to Maria, who will end with some closing words. Thank you all.
Great. Thank you so much, scholars. You've heard it at least twice tonight. We are very proud of the work you're doing and proud to have helped you do it and proud that you will continue on your work. We feel like we're a part of who you are becoming, and we thank you for letting us be a part of your I hate that word, journey, but indeed it is a journey. So thank you, scholars. I wonder if Ava could put up the last two slides, that second to last one that has our contact, the one before that, if you don't mind. Right, I just wanted to put this up here, just so you know, our scholars had to, and are finishing up, many of them, their long research project that you heard about. They also have slides, and they also have worked on brief policy notes for policymakers, for change makers, for you in the audience who want to do something and concretize the work that you've seen them do. On the screen right now is our website, our social media handles. By tomorrow, all of the policy notes for our scholars will be up on our website, so you can take a look at them. And in the coming weeks, their final presentations as they come in will also be put up. But those 1 or 2 page policy notes are really kind of executive summaries. So if you missed something, if you want to hear a little bit more about it, if you didn't write down their contact information, the scholars' information will all be there. So that's www.womennc.org, and it's up there on your screen now. So I urge you not just to go to our website to see our scholars, see all the other things we're doing. I spoke a little bit about this in the beginning of the project, in the presentation tonight. You can also see former scholars' work. As I said, this is our 13th year. All the scholars' research is up there. All of the policy solutions are up there for you to explore and use in your own research and advocacy. So I commend you to womennc.org. And now we could just move to the final slide before I say goodnight to everyone. This is the first year that WomenNC will be presenting and has been invited to do 2 presentations at the NGO Forum. And as you can see on the screen right now, on Wednesday afternoon at 4 o'clock, 2 former WomenNC scholars, 2 alumna, Nyla Segula and Jackie Lanning, will be joining folks from Harvard's Healthy Buildings team to talk about gender disparities in the built environment, in the natural environment, and really addressing issues of climate change, gender equity, and how those impact health disparities. So again, that the ability for you to register, you do need to register like this one. It will be on our Facebook Live page as well. But I urge you, if this is a concern of yours, to join us Wednesday afternoon, or at least Wednesday Eastern time afternoon, and you can find information for registering on our website. I want to thank everyone who participated, as I said earlier. I also want to give a sincere and large shout out to everyone from RTI's Global Gender Center, including Dr. Wendy Wexberg, its director. Without our affiliation, collaboration, and partnership With RTI's Global Gender Center, none of the femtoring that you heard a little bit about, many of the resources, expertise that our scholars, as you can see, used quite nicely, those would not be available to us. So as women tend to do, we collaborate, we work with people, and we sincerely thank RTI's Global Gender Center for their work with WomenNC and the scholars. So I think with that, we will end the program, give you back 4 minutes of your time. Thank you for coming. Please visit our website. Please ask questions of the scholars as you think of them as you go along. And we look forward to seeing you on Wednesday afternoon and on our website to explore the good work that WomenNC is doing for women in North Carolina. Thank you and have a good rest of your day.